Afternoon. Once again, kind of a shift in direction here. I'm Carr Ingham. I'm a longtime petroleum economist for the Alliance, and now executive vice president. And just to lay the framework for our discussion right now, we have, as most of you know, particularly our members and operator members, a long-term, 30-year plus, very successful insurance program through One Star Insurance Solutions. Boley Featherston as the top agent for these programs on our insurance programs, which are general liability, property casualty, control of well, auto, et cetera, et cetera. And these have been great programs for our members. They pay dividends back to our members and to the policyholders, and we're just so thankful for our relationship, a long, great relationship with One Star Insurance Solutions and our agents out there who carry that program forward, and for all our members who are able to avail themselves of this. We have for some time desired to find a healthcare program that we could offer to our members in kind of that same thought process, something that our members can avail themselves of, that makes it to an even greater extent of value to be a member of the Texas Alliance of Energy Producers, something that we could offer to our members that is better than they would be able to find in the general marketplace out there potentially. And so in these days of employers struggling to find ways to provide affordable yet meaningful benefits in terms of health insurance and related products to their employees as an organization, we've again been on the hunt for that very thing. We found them, we believe. So our friends at Davidson Insurance Services in the Dallas-Fort Worth area, Bobby Davidson, owner and president of Davidson Insurance Services, and then Fred Meijering, the captive manager, and I'll let him tell you exactly what that term means. But I will turn this over to them and let them explain it. But essentially, this is agreement that we have entered into with David Insurance Services exclusively for the Texas Alliance of Energy Producers in the state of Texas to offer this benefit to our members. And we would not do this if we did not think that it would bring value and potentially great value to you in terms of the quality of healthcare insurance that you're able to offer to your employees at a reduced rate. And I mean, potentially a considerably reduced rate. These are things that have us very excited about this possibility. So as we did with our other insurance programs, we intend to have this in place for a long time and to grow it over time. And so it's my pleasure to introduce these two gentlemen to you today, Bobby Davidson and Fred Meijering with Davidson Insurance Services. Gentlemen, welcome. Thank you so much for taking the time to do this for us today.
Thank you, Carr. Well, we appreciate the time, and thank you to the Alliance for giving us some time on your program today. We're really excited to be able to extend this association healthcare plan to your membership. I want to talk a little bit about why and how we can add value in the association space. So the association space for healthcare has been a little troubled over the years, and we've decoded that by adding in the background of these health plans a captive. A captive is synonymous with insurance company, except it's privately owned by the members and the folks that are involved with it. But what it gives us the opportunity to do is spread the risk in the background of the plan so that when folks have high claims that would otherwise get them a super high renewal, we spread that over the entire group because the entire group's not having high claims, and it keeps the rates lower and it has the renewals to be lower also. And so that's simply stated the logic of these plans. We have a number of associations in the program. You've probably received these two flyers by email from your association. One's ABA and one's Lifestyles. They talk about the two medical offerings we have and the voluntary inside of them. And we've prepared a kind of a very short presentation for today. If we can get that on the screen, we'll just talk about that for a few minutes on some of the highlights. So one of the TPAs and medical plans we use is ABA. And what you'll see in there is the Cigna National Network, which is a national, I'm sure you recognize the name, it's in all 50 states. There's no referral needed, they're PPO plans, we offer 2 HSAs. We have a powerful pharmacy benefit management program in there that cuts costs of prescriptions, especially specialty plans. It does have no cost telemedicine, no copay, no deductible, unlimited use, which saves a lot of money. These programs are available for groups 5 and up, 5 employees and up. And then once you get to 10 life group, we can offer 2 plans. Below that, it's 1. And we have 5 plans to choose from. We'll go over in just a second. And all of these plans are Affordable Care Act compliant. They're full major medical plans, just like you might have if you have a Blue Cross or United Healthcare. So they're compliant in every way that a healthcare plan can be compliant. And what's interesting, because they're level pay on a self-funded chassis, the claims dollars that you don't use in a year, if you have low claims, 100% of that money is returned back to you. And so that's a little interesting provision there to get some of that unused premium back. If we go to the next page, and you'll find this in your brochure when you get a chance to look at it, these are the 5 plans that we offer in the program. There's 3 PPOs there with different deductible levels and 2 high deductible health plans with health savings accounts. And when you get a chance, you can look at that in your brochure in greater detail. But these plans really cover the waterfront of what we see groups wanting out there, from a Cadillac plan all the way to a high deductible health savings account plan. If we turn the page one more time, we have a wonderful dental program, 750 annual max, 1,500 and 3,000. These are very robust national contracts. We quote through Unum and Principal, and we find the premiums 2/3 of what you normally find in the market because of our buying power and our national contract that's available in this offering as well. If we go to the next slide, you can see the vision plan that we offer, and we see the same kind of market benefit with our vision plans as we do with the dental, with our strong national contracts. If you flip to the next page, you can see this is where we have our basic voluntary life and accidental death and dismemberment is available. And then the final page, you'll see we have disability plans available as well. You don't have to offer all of these things. You can offer as much or as little as you want. But we run 10 to 40% below market. And right now we're averaging about 30%. And it's all because of that claim sharing in the back and the captive arrangement. So that's a very high level summary about what we offer. In the back of your brochure, you'll see a contact person to initiate the quoting process, or if you have questions about it. We know fourth quarter is coming up here, and that's when about 75% of the groups renew. So keep us in mind if you want to take a look at lower rates, or if you're unhappy with your renewal.
That's great, Fred. Bobby, do you have anything to add to that, just from your alignment now with us and the company's approach to this, to health insurance coverage in this particular space, the association space, and how you kind of developed that to this point?
What what I like to, first of all, I would, if I was in your association, I would give a lot of thanks to all the leadership that has brought this to you. We do believe that this is going to bring a lot of savings to you. What I like to associate this with is like an American Airlines employee. If you walk into an American Airlines and join, their company, you're going to be able to save a ton of money just because of their volume, because of their size. They've got 200,000 employees, or somewhere between 100 and 200,000 employees. And because of that, your health insurance rates are going to be really low, and all of these ancillary benefits that Fred just went over are going to be really low. And we've negotiated these national contracts, and now they're going to be available to you. I can't encourage you more to at least try to take the journey. Step in, and we can show you what we can do. You have to think about it like you aren't losing anything, you're gaining things. A lot of the times, Fred, you'll have to agree that when people come into this, they see that we improve their benefits. We don't take benefits away. Some people increase their benefits because it even makes the savings even more. We've had clients that have saved 50+% just by switching from maybe a $2,000 deductible to a $6,000 deductible. That was purely their choice. But in these days and times, saving that money is a big deal. It's a big part of your budget. And I would really encourage you to take a look at it.
Well, the opportunity to address this problem, I think all of us have been fighting this battle for a number of years now in terms of coverage for ourselves, for our families, for employees. They've been through Affordable Care Act, Obamacare, or some other words to describe that we probably can't say in polite company. Watching these numbers go up in terms of the cost of these programs, watching the benefit levels go down in terms of what's covered, higher deductibles, on and on and on. You know what I'm talking about, and so does everybody else listening. So the opportunity to do this and provide a higher quality coverage product than what perhaps they may have now at 10% to 40%, let's say even at 20 to 30%, that just almost sounds too good to be true. Is it?
No,
it really isn't. And like I mentioned earlier, Carr, we're averaging just over 30% reduction compared to market rates on the fully insured space. And part of the logic there, we talked about how the captive works by spreading the risk in the back. Another big part of this is that these plans were debundled. And what debundled means is we took the pieces parts of the health plan, the network, the pharmacy benefit management, the third-party administration, the reinsurance, and the claims fund management, and we managed those separately. When you buy a fully insured plan, those are all connected under the same umbrella and provided by the same people. So they can have arrangements in there that help each other out, add fees, and increase the rates. And so that's not possible in our arrangement because all of those vendors are separate and unrelated, and they don't know each other. And we do that on purpose. We provide transparency and optics into every penny of spend, and we've negotiated those contracts carefully so that they can't overlap, so that they are performing against a standard. And if they don't, we simply remove them and replace them without any interruption to the plan. And so these plans are carefully constructed, removing all of the fat and the excess so that we can bring maximum value to the customer. And how they see that is in terms of the premium. Even the pharmacy benefit management program that we use reduces the premiums by almost 30% in a lot of cases because we've ensured that the rebates from the drug manufacturers come back to the claims fund. And we've taken out all of the 11 ways that we know a pharmacy benefit manager can make money by fulfilling a script. And we audit against that every year. And so these are the kinds of things that went into this plan. We built this program and these plans to specifically address what we thought was wasteful and excessive. Because our mission is the best possible healthcare at the lowest possible price. And to do that, we had to tear these things apart completely and rebuild them in a way that it couldn't get back to where it was before.
In terms of the spread of the risk across the pool, I want to make sure that I understand this and that our members who are listening understand this. We're not just talking about the alliance in and of itself, and those that come in under our program. We're talking about the alliance plus other associations that are a part of that program as well. And some of these I know. I don't know nearly all of them, but some of these I know and have talked to one or two of them. Texas Food and Fuel Association, a national kind of electric buyers co-op. I think you've got the Texas veterinary medicine guys, don't you? But we're talking about spreading the risk across that entire pool, right? Not just those from the alliance that are in that program.
That's exactly right. There's well over 100,000 bodies inside of this program sharing risk across all of those groups. And that's a very significant number to spread risk.
So there are a couple of things I think that are limitations. We just want to make sure that our folks know and know of on the front end. First of all, there's kind of a size of company, right? We do have a number of smaller companies, smaller independents. That's who we are and where we come from. So if you've got a smaller, I mean, there is a minimum number of employees that could be a part of a group, correct?
It's five, and it's five, but it goes up to the largest company that you've got. We can do, it's five to infinity, just put it that way. So we can handle anything above five or above. And I think you guys, you mentioned something, Carr. We started with this journey about 3 years ago. Fred and Janet and I got together, and we've got 100 years between us in the health insurance, business, and that's probably not the right thing to say, but we do. And we sat down for hours and hours and days and weeks, and we all, we said, what do we not like about this industry? What do we not like about what's going on with the healthcare in our country? And we, like Fred said, we took it, we debundled things, we shaved our fees, we took out a lot of the cost. So now we can bring a program to you that is much lower cost with equal to, or if not better, benefits. And again, like I wanted to say before, I think that everybody's got to realize this is going to be the same thing that they're involved with now if they're with a Blue Cross, what we call the BUCAs, Blue Cross, United, Aetna, Cigna. If they're with one of the BUCAs now, all they're going to be responsible for is coming in and paying their premium. That's it. They pay their premium month 1 through 12, and that's it. That's all they're responsible for. There isn't any terminal liability. Normally, if you go into a self-insured type plan, there's fees to go in and there's fees to exit. With this, there's no more fees except for your premium. And that's the way we set it up. We didn't want anybody to have there's no liability, nothing there for them. So it's exactly like if they're on a fully insured plan, it would be exactly like they're on now.
And one other aspect of this, and this is also the case in our property casualty general liability program with our friends at One Star, it's not a take-all-comers thing. The companies are individually underwritten, and the logic on the other side is that it creates a higher quality overall program. But I wonder if you can speak to that and deliver some assurance in terms of acceptance rates and that sort of thing.
I think that if you have reasonable health within your group, and when I say reasonable, every group has some kind of health problem. We know that. If you have reasonable health within your group, you should be accepted in. We got one of the very first cases we got, I'll never forget this. We got a 5-life group that came in, and it had 3 AIDS patients in it. And we did not accept them, but we got rates on the next 150 cases, and it wasn't any big deal. We realized that was just one that, quite frankly, it would hurt. It would hurt the captive that they would go into. So it would hurt the association overall. Occasionally you're going to run into those groups that are very sick, and we're not going to be able to take them, and we're sorry for that. But for the most part, we should be able to take and save money for everybody in the association.
It's with rare exception that we decline a case, and it is usually pretty dire health circumstances. The good news is, though, in the ACA environment, they can get a community-rated, fully insured plan, which would be much cheaper than if we could offer rates.
If I might just interject, we did have a group that came in last year that had about 110 lives. Not to their own fault. They came in pretty healthy, but they got really sick. I've never seen it in over 30 years in the health insurance business. You're trying to run at about a 70% loss ratio, 80% loss ratio. 80% means that, the insurance company's making that 20 there. So that's about what you want to run. This one ran at 5,000%. We had never even seen or heard of anything like that. And normally an insurance company would automatically turn you down or give you such a high increase that you couldn't afford it anymore. Our increase back to them was 10%. So that just shows you that the program is working, that your renewals, if you're normally seeing through a BUCA, if you normally see a 15% renewal, through us, you should see probably maximum 5%, and a lot of times a pass. Most of them that we see are passes that come back. So this is truly a plan that you can be in for the next 5 years, 7 years, 10 years. And that's unusual in this world. Everybody has to shop every year and on and on. We like to believe that most people could stay in it certainly 5 or more years. That's kind of a baseline.
So we're all skeptics, right, when it comes to insurance, and I guarantee you, there's somebody out there right now thinking they're going to give me 25% up front, and then they're going to clobber me with 20% at my next renewal. You want to speak to that concern?
Yeah, Bobby mentioned rate passes, and so our last renewal cycle coming out of last year, over half of the groups that we have got a 0% increase. And our average was just over 3%.
I believe the highest one that we got was the 10% on the group that ran at 5,000%. So a 5,000% loss ratio, that's unheard of.
Well, I think the hope would be, obviously, if somebody switches at a 25, 30 or better percent reduction in cost, that they will essentially be able to kind of stay on that tier of reduced costs and not see that ticking up at even 5%, 8% over time. What they would view as a company trying to get back to that kind of baseline rate that they were originally discounted. So I don't mean to beat that dead horse, but again, it is a common concern out there, is it not?
Well, Carr, again, it's a very unusual opportunity for your members. They're going to be able to come in, and they're not going to be on an island by themselves. So you got a 20 life group, and it's based right now with the BUCAs, it's based on how your 20 life group runs. Again, the risk is going to be spread out amongst the masses. Once in every 5 years, every group's going to have a bad year. Correct, Fred?
Correct.
And I mean, that's just fact. So every 5 years, you're going to run poorly, and then you're going to pay for it with the BUCAs. With us, you're not going to pay for it. You're going to spread it amongst the masses. And so, that's part of the beauty of our plan.
So,
I'm sorry. Go ahead, Fred.
yeah, Bobby talked about a group having a bad year 1 in every 5 years. That means 4 are not. And that means that premium is sitting in the captive waiting to help the 5th group who's having a bad year, knowing that each one of those groups is eventually going to have a bad year and want that same relief. And that's what keeps the rates low and the renewals low.
Okay, just 1 or 2 other really quick things. Are there any geographic concerns here? I mean, if you own a company and you're based in not a metro area, are there concerns about coverage, availability of doctors, networks, all of these things?
No, right now, predominantly we've got the National Cigna network that's pretty much all over the state of Texas. We also have private healthcare systems, PHCS, which is the largest network in the nation. We have First Health. If you get into a real rural, small area, we're going to come up with another network that fits your area. It's somebody that you're used to that covers the doctors in your area. That you don't have to worry about. We'll take care of that for you.
And West Texas is really strong with First Health, and there's also some direct contracts or regionally optimized networks. All of that to say, Carr, that we'll be able to bring the strongest networks forward that are available in any piece of geography.
Well, gentlemen, it's straight up 4 o'clock. I really wanted to ask a question about your concierge service, and we'll just have to tease them with that a little bit and provide that information to them as we can or when you hear from them. I want to thank you both again for taking the time to come visit with us today, and we are unbelievably excited about this partnership with you.
Oh, thank you so much.
Thank you so much.
We're as excited as well. Thank you so much for everybody coming on.
Appreciate the time.
Okay, great. So if you've got questions about this, again, we've sent this information. If you need it, just contact our office. And Janet Jennings at Davidson Insurance Services, your starting point there. But if you need other information from us before you get to that point, or to provide that contact information to you, just let us know at our office and we'll put you in touch.